we have some bleeding, it's good. That's what we like to see instead of yellowish stuff. So I'm just cleaning a little bit, trying to absorb that saline that I'm flushing.
Finished?
No. Not yet. Let me take my picture before I forget. I get too much into doing the one and I forgot my picture. I need it.
Well, I'm glad you like it.
Yes, sir. Are you glad that some people has interest in some things, you know? It's like, I will not do mother baby, you know, labor and delivery. Hey, no. I prefer my wounds and all that, so. Okay. Okay, we usually like to do a little bit of skin prep around the skin. It protects the skin. If there's a little bit of drainage, you know, if it gets in touch with the skin, it's not gonna hurt skin. Because sometimes the skin can get a little too wet. So this is just like a skin prep. Upside down.
Looks like it's trying to talk, babe.
Okay, so here we go. We use one of these Q-tips. And get that. We usually use this end because it's the, you know, smallest one to go in, and we try to go as the wound is. You know, it's a little bit. It's 5 here, 3 here, a little bit here. So we try to get all over. But
oh, it's so gonna kill me.
there. Just push it a little far, but now I'm not gonna go too much. You know. There.
When they said it was packed, I just imagined it packed with like a bunch of gauze. I wasn't thinking about it.
Or like a tiny narrow, yes, yeah. And this is the choice for this type of wounds. They're very narrow, so. You okay?
Mm-hmm. It's fine. You're fine, baby.
Okay. And you can feel when it starts getting a little bit too tight around, so you know, it tells you not to go further. You just feel
How would I know if I messed up and just didn't put enough in there?
Even if you didn't put enough, you're not gonna mess up, okay? As long as we have something, like I said, for the means for that drainage to come out, you're good, you know? And that's what I said in the beginning. Just try to go as far as you can first, and then, you know, you keep going. But it should be fine, you know? It's not, that's the main thing. Tissue is gonna start rebuilding, so you're not gonna mess up, okay? Hold it right there.
Now this I think I can do, but I can't stand to give him his testosterone shots.
Oh.
And his backside.
Okay. And we just do. He had some tape. We usually prefer wrapping with the roll.
Yeah.
Is that something he will do better? You think? Is he moving around right now? As far as
well, last night that was what was on him, and that's when his feelings started coming back. That's what he was trying his best to rip off, and we were having to stop him.
Let me do this. I'm gonna secure this ABD. This is just my secondary dressing, so the drainage can't be catch here. So I'm gonna tape a little bit on the sides to keep it in the skin, but I'm gonna wrap it with the Curlix. And if this one, you know, comes out, you can just reapply it. Also, this one, if it gets too saturated with drainage, it can be changed, but just leave the packing. The packing, we just do it once a day. Okay. So everything else can be done as needed, but the packing is just daily, once a day. Okay, can you lift your leg up a little bit? No? Okay.